In this video, I'm going to talk about clinical reasoning for pre-manipulative screening for vertebrobasilar insufficiency.
Get our very own assessment ebook and mobile app. Links are in the video description.
Hi and welcome back to Physiotutors. The vertebral artery supplies blood flow to the hindbrain and courses through the transverse foramina of the cervical levels from C6 to C1 and is tethered at foramina C2, C1 and the atlanto-occipital membrane. Abnormal stress, amongst others, through cervical rotation on this artery may lead to a reduction of blood flow to the hindbrain, which we call Vertebrobasilar Insufficiency or VBI, a condition that can develop into cerebral or brainstem ischemia and lead to severe morbidity or death. Estimations of the incidence of a VBI vary between 1 incident in 5 million therapy sessions to 1 incident in 400,000 cervical manipulations to 1 cerebrovascular accident in 100,000 patients aged 45 or younger, according to Rivet et al. In 2005. The debate if cervical manipulation can lead to a dissection of the vertebrobasilar artery is ongoing, although the literature has failed to provide a clear link between the two. The classical ischemic signs characteristic for VBI include the 5 Ds: dizziness, diplopia, or in other words, double vision, dysphagia, which is a difficulty in swallowing, dysarthria, which means problems with the muscles that produce speech, and drop attacks. Furthermore, they include the 3 Ns, which are nausea, nystagmus, which is a condition of involuntary eye movement, and ipsilateral numbness in the face, as well as 1A, which is ataxia, which describes lack of voluntary coordination of muscle movements, which include gait abnormalities. Taylor et al. In the year 2010 mentioned that these signs rarely present in isolation in case of a VBI. Most of the time, these ischemic signs are preceded by non-ischemic signs, which are ipsilateral posterior neck pain and/or occipital headache and C5, C6 cervical nerve root impairment, in rare cases due to lack of blood supply. Oftentimes, the headache is described as headache like no other and severe in nature. As those symptoms are very common in our general neck pain and headache population, it is very important to look for risk factors which could indicate a lesion of the vertebrobasilar artery. These can be divided into 1. Mechanical forces and 2. Risk factors indicating an underlying pathology like atherosclerosis. Mechanical risk factors include a preceding trauma to the head, like in extreme neck movements during whiplash, sport, cervical manipulations, etc. But also include onset of symptoms after innocuous day-to-day movements like visiting the hairdresser or turning to reverse the car. Another mechanical risk factor can be upper cervical instability. You can watch a video about that by a click in the top right corner. Risk factors for underlying pathology include hypertension, hypercholesterolemia, hyperlipidemia, hyperhomocysteinemia, diabetes, genetic clotting diseases, infections, smoking, free radicals, direct vessel trauma, or iatrogenic causes like surgery or medical interventions. Be aware that vertebrobasilar insufficiency can mask as usual neck pain with headache during early symptoms. Therefore, ask for risk factors of mechanical forces and underlying pathology. Late symptoms include the 5 Ds, 3 Ns and 1A, and have to be assessed. Then perform your physical examination, including cervical instability and blood flow tests, but be aware of the limited value in screening. At last, make a risk-benefit analysis to decide whether cervical manipulation is indicated. Okay, this was our video on clinical reasoning for pre-manipulative screening for VBI. While a lot of focus has been placed on the vertebrobasilar artery, 80% of our blood flow to the brain are supplied by the carotid arteries, in which pathological changes are very common. Therefore, please click on the video right next to me to learn more about screening for insufficiency of the carotid arteries. We hope this video is helpful to you and you will develop a high index of suspicion for VBI. Make sure to give this video a thumbs up, comment down below if anything is still unclear, and subscribe to our channel. You can find more information about us on Facebook, Instagram and on Physiotutors.com. This was Kai for Physiotutors. I'll see you in the next video. Bye.